Chapter 29 Sexual Assault. The objectives for this module will be to define sexual assault, sexual violence, attempted rape, and completed rape. Also, to identify potential relationships between sexual offenders and victims, including marital rape, statutory rape, date rape, and drug facilitated sexual assault. In our case study, Indira, a 20-year-old woman, is brought to the ED by two friends who say that Indira has been hurt by someone at a party. She won't tell them who hurt her or what happened. She was willing to be brought to the ED, however. One friend says, "We were at this party and when these guys introduced themselves, and one asked Indira to dance with him. We tried to keep our eyes on each other, but we lost track of Indira somehow, until we found her in a bedroom upstairs. She was all messed up and crying." There's going to be many different forms of sexual assault and sexual violence, including unwanted sexual advances and sexual harassment. Also, attempted rape and completed rape. Other forms could even include incest, human sex trafficking, and female genital mutilation. Attempted rape would be defined as threats of rape or the intention to rape that is unsuccessful, whereas completed rape is any penetration, no matter how slight, of the vagina or anus with any object or part of the body, or oral penetration by a sex organ of another person without the consent of the victim. Sexual offenders and the relationships with their victims. It could also take many other forms, such as spousal or marital rape, statutory rape, which involves minors that do not have the capacity for consent, date rape and acquaintance rape, and drug-facilitated sexual assault. The Drug-Induced Rape Prevention and Punishment Act of 1996 allows up to 20 years imprisonment and fines for anyone who tends to commit a violent crime by administering a controlled substance to an unknowing individual. Due in large part to the feminist movement, marital rape was outlawed in 50 states by the early 90s. It took longer for laws to sentence perpetrators the same way. One U.S. state still requires that violence or the threat of violence exist in order to be considered rape. Laws in sexual assault. You need to know the legal definitions within each state, as they're going to vary state by state, and also know your state's reporting requirements. All states require reporting if the victim is defined as a child by state law, and most states require reporting if the victim is a dependent adult. State and tribal governments must reimburse for sexual assault examinations. Our other objectives will be to discuss the epidemiology of rape, stalking, and sexual assault. Also, to describe the role of the sexual assault nurse examiner to a colleague. For the epidemiology of rape victims, 19.3% of women and 1.7% of men. For females, the first rape experience happened before the age of 25 in nearly 79% of cases, and before the age of 18 in 40%. Both male and female are more likely to be raped by a male. The lifetime prevalence and 12-month prevalence of intimate partner rape is estimated at nearly 9% and around 1% respectively. In the case of stalking, it occurs about 15% of women and nearly 6% of men. And over a 12-month time period, 4% of women and 2% of men. Sexual violence is also underreported. In helping to deal with this are specialized sexual assault services, such as SANE nurses or sexual assault nurse examiners. These are RNs with specialized training in caring for sexual assault patients. They have a demonstrated competency in conducting medical and legal evaluations, and an ability to be an expert witness in court. You also hear the term Sexual Assault Response Team, or SART, though most facilities I know go with the SANE acronym. The long-term effects of sexual assault include depression, suicide, anxiety, fear, difficulty with daily functioning, low self-esteem, sexual dysfunction, and somatic complaints. Other effects include recurrent and intrusive memories, dreams, flashbacks, and psychological or physiological distress in response to cues that remind the individual of the assault. The dissociative symptoms, altered sense of reality, and an inability to remember, amnesia. Avoidance of the situation, including places, events, or objects that reminded them of the experience. And hyperalertness. This is easily startled, anxiety, and angry outbursts from the emotional dysregulation of the traumatic event. Some people experience depersonalization and derealization as well. For the effects of history of sexual assault could also be anxiety disorders, chemical dependency, suicide, self-mutilation, compulsive sexual behavior, and psychosis-like symptoms. For the effects of incest victims may experience negative self image, depression, eating disorders, personality disorders, self destructive behaviors, and substance use. Application of the nursing process. For our objectives, describe common reactions to rape and sexual assault. Identify 5 areas to assess when working with a person who has been sexually assaulted, and analyze the personal thoughts and feelings regarding rape and its impact on survivors. For our general assessment, we're going to assess their level of anxiety, their coping mechanisms, their available support systems, signs and symptoms of emotional trauma, and signs and symptoms of physical trauma. Also, for their self assessment, examine your feelings before encountering a patient who's been sexually assaulted. Always avoid asking why questions because they're inherently evaluative. For example, why did you walk home alone, or why didn't you run? Your best practice guidelines in these scenarios are going to be to examination through 5 steps. It will begin with a head to toe physical assessment for signs of injury, a detailed genital examination, evidence collection and preservation, documentation of physical findings, and the treatment, discharge planning, and follow up care. Continuing with our case study, Indira, the student whose friends have brought her to the ED after the party, tells the nurse that she has been raped. She's shaking and begins to sob, hyperventilating. She appears to have a small amount of blood under 3 of her fingernails on each hand, and bruises on her wrists and inner thighs. Her lip is beginning to swell, and she has a scratch along her jaw and eyebrow. Predict what information should not be obtained during Indira's initial medical exam. Would that be A, ascertaining what she might have done to provoke this situation? B, documenting biological and physical findings? C, collecting evidence? Or D, arranging follow-up care as needed to document additional evidence? And that answer is obviously going to be A. It's inappropriate to obtain all the following at this point, with one exception, asking what she might have done to provoke this. It is not an appropriate question. And what areas should you include in your assessment of Indira? One would be assessing her psychological trauma and document the patient's verbatim statements. Assess their level of anxiety. And if in a severe panic level of anxiety, the patient will not be able to problem solve or process information. You also want to assess the physical trauma. Use a pre-printed body map and ask permission to take photographs. Also, assess available support systems. Often the partner or family members do not understand the trauma of rape, and they may not be able to best support or draw on at this time. Identify common community supports and encourage the patient to talk about the experience, but do not press the patient to do so. What would be some appropriate questions to ask Indira to determine her coping mechanisms? Some useful questions might be, what are you thinking and feeling? What can I do to help you in this difficult situation? Or what has helped in the past? Our next objectives will be to identify priority nursing diagnoses to address responses to sexual assault. Also, formulate 2 long-term outcomes and 2 short-term goals for the nursing diagnoses rape trauma. Our primary nursing diagnoses are going to be victim of sexual assault, rape trauma, or rape trauma response. Other potential additional nursing diagnoses include disturbed personal identity, situational low self-esteem, interrupted family process, impaired sexual functioning, anxiety and/or fear, or social isolation. For our outcomes identification, it's going to be improved responses to the traumatic experience. The diagnosis rape trauma response addresses longer-term reactions. It is defined as a maladaptive response that occurs to the victim after a rape associated with disorganized lifestyle and long-term process of reorganization of lifestyle. For our outcomes identification, it's going to be improved responses to the traumatic experience. And the plan of care must include follow-up care for that post-acute phase. Improvement may be indicated prior to leaving the acute care setting, includes verbalizing details of the experience, expressing feelings, understanding the common responses to assault, identifying a short-term plan, and to deal with the immediate situation and connecting with a community-based rape victims advocate. Longer-term goals include physical healing, emotional healing of intrusive memories and nightmares, and reduction in fear and anxiety, along with improved social interactions. Their objectives include identify 5 overall guidelines for nursing interventions related to sexual assault in emergency settings. Discuss 3 evaluation criteria that would indicate improvement of responses or resolution for a person who has suffered a sexual assault. Also, identify psychological therapies that are useful in treating individuals who have experienced a sexual assault. Implementation would include counseling, promotion of self-care activities, and case management. Counseling is especially important to help the survivor and significant others to separate issues of vulnerability from blame. Although the person may have made choices that made her more vulnerable, she is not to blame for the rape. She may, however, decide to avoid some of those choices in the future, such as walking alone late at night or excessive use of alcohol. Focusing on one's behavior, which is controllable, allows the survivor to believe that similar experiences can be avoided in the future. The recommended emergency nursing care protocol would include providing a safe and private environment, as well as access to community-based advocates. Also, to administer a trauma-informed approach that is consistent, objective, and along with immediate medical care. Also, care and consultation with a sane trained forensic nurse, as well as medically appropriate STD prophylaxis and emergency contraception. The part of providing is consistent, objective, immediate medical care, includes the collection of evidence by emergency nurses and physicians who know the protocols for evidence collection. Continuing with our case study, Indira, a student who was raped at a party, accepted care in the ED and was referred to a nurse counselor afterwards for help with recovery. Specific areas of concern for her were intrusive symptoms, including flashbacks, nightmares, and frequently interrupted sleep. At first she received private counseling, but later she joined a group session, which she found supportive and encouraging. For evaluation, sexual assault survivors are considered to be in recovery if they are relatively free of any signs or symptoms of acute stress disorder and PTSD. Signs of recovery include sleeping well with few instances of episodic nightmares or broken sleep eating as they did before the rape. Being calm and relaxed or only mildly suspicious, fearful, or restless, getting support from family and friends. Have a generally positive self-regard about themselves. Have the absence or only mild instances of somatic reactions, and are returning to the pre-rape sexual functioning and interest. For our evaluation criteria, again, that patient will sleep well with few nightmares or wake-ups, eat as they did pre-rape, retain normal levels of calm and relaxation, get support from family and friends, demonstrate a positive self-regard, experience little or no somatic reactions, and return to pre-rape sexual functioning and interest. There could be many different psychological therapies an advanced practice RN could utilize, everything from individual therapy, group therapy, survivor therapy, and perpetrator therapy. By virtue of the legal definition of the relationship, rape cannot occur within a marriage. Is that true or false? Obviously, that is false. Rape is defined in the context of non-consensual activity and involves any penetration. And for our last question, in Indira's flashbacks, frightening thoughts, recurrent memories, and nightmares are associated with which category and symptoms of PTSD? Would that be A, intrusive, B, dissociative, C, avoidance, or D, arousal? And that answer is going to be A, intrusive symptoms. Intrusive symptoms include recurrent and intrusive memories, dreams, flashbacks, and psychological or physiological distress in response to cues that remind the individual of the assault.